Morning, everyone, and thank you for being here. I'd like to turn it over to our esteemed president, Dr. Charlotte Morris, to bring us greetings.
Thank you, Attorney James, to you and to all the keynote speakers and panelists listed on the program, other participants, and all assembled this morning. I extend greetings and best wishes to each of you. We are pleased we are pleased to have you participate in this, our 22nd annual One Health Symposium this morning. As we face challenges at the crossroads of presidential mandates, partisan politics, and geopolitical disputes about government funding initiatives, pandemic protocols, voting rights, abortion laws, and racial justice issues, seemingly irreconcilable differences between citizens and the legislators in our country, there is definitely a need to transcend institutional and disciplinary boundaries in our society. COVID-19 is real and has affected so many of our lives during the last year and a half. But despite this unsettling environment, Tuskegee University is weathering the storm with perseverance, resilience, and with a small measure of success. Let me be clear, however, we do have our challenges, but most of them turn into opportunities for us, mainly because a number of these individuals who are on this call who have gone the extra mile to provide needed education, information, and frank discussions about the environment in which we find ourselves currently. It is without a doubt that continued discussions such as the ones provided through this symposium will do much to advance our body of knowledge in this space. Some of you may be interested to know that Tuskegee is in the process of rolling out its new strategic plan for the next 5 years. It will serve as our guide as we move the university forward. The elements of that plan are based on 8 pillars: academic excellence, student experiences, operational efficiency, world-class faculty and staff, research, innovation, and entrepreneurship, advances in infrastructure and resources, athletics, and community and strategic partnerships. We invite you to follow us on this journey as we move toward one vision of a preeminent educational and research institution that develops innovative and transformative leaders who solve the world's most complex problems, all in the spirit of One Tuskegee. Greetings again, and thank you all for attending this symposium this morning.
Thank you, Dr. Morris. And now we'll hear from our Dean, Dr. Ruby Perry.
All right, just bear with me. Thank you, Attorney James, and thank you, President Morris, for your welcome and introduction. So good morning, everyone, and welcome to the 22nd Annual One Health Symposium and the 9th Annual Phi Zeta Research Day. The symposium's theme, One Health, Transcending Institutional and Disciplinary Boundaries, is not only aligned with the synergistic work of biomedical researchers, but also most befitting in the current coronavirus pandemic. Although the coronavirus pandemic has pushed us into a virtual platform delivery for both venues, we have an exciting 2 days of scientific presentations and panelists to bring perspectives to the challenges of COVID-19. and focus on the One Health triad on healthy people, healthy environment, and healthy animals. The annual One Health Symposium is a forum for research collaborations and a platform for advancing biomedical research from a perspective of interconnections amongst healthy people, healthy environments, and healthy animals. The annual symposium is also a forum to heighten awareness of global health disparities as well. The coronavirus COVID-19 pandemic has not only caused devastation on people and the economy, it has impacted even more severely in communities with health disparities and lack of access to medical care. This year, the focus on communications and sharing of science research breakthroughs, public health measures, and best practices relative to safety and prevention in this pandemic are essential to contain the spread of the virus and decrease the devastation of the disease. It is definitely a One Health approach to emergency response as delivered by our colleagues from the Centers for Disease Control and Prevention, Dr. Rochelle Walensky, the CDC Director, and Dr. Casey Baravesh. I salute all of our outstanding speakers and extend my appreciation to the One Health Symposium Committee, co-chaired by Dr. Nashar and Attorney James. Thank you for attending and participating in our last, hopefully, our last virtual annual One Health Symposium, and hope that you enjoy the sessions and other features designed for your educational enjoyment. Thank you.